For now, I will introduce Sandra Holsworth, who is a Theme 5 CDTRP patient and family donor co-lead, who will introduce our speaker for today. Sandra, if you're ready.
Thanks. So welcome everybody. I'm Sandra Holsworth, and I've had the pleasure of meeting Dr. Amy Waterman a couple times, once in Toronto and once out in Banff. She is a division chief for the patient engagement and diversity for the Center for Outcomes Research at the Houston Methodist Research Institute, the director of patient engagement, equity, and education for the Department of Surgery at the Houston Methodist Hospital, an affiliate faculty member of the Terasaki Research Institute. Dr. Waterman's research examines how best to expand access to transplant, reduce racial disparities in transplant, ensure informed decision-making, ensure transplant adherence, promote paired donation, and increase living donation rates. Her research incorporates many components of clinical and translational research, including patient-oriented research, clinical trials, behavioral studies, development of new educational technologies, cost-effectiveness analyses, outcomes, and health services research and implementation of best practices. Dr. Waterman collaborates with and mentors other researchers in nephrology, urology, health services research, economics, public health, and nursing, with expertise and interest in transplantation or education research. She has published more than 80 research articles and book chapters. Dr. Waterman also designs and tests the efficacy of new patient and living donor educational resources, including brochures, videos, mobile applications, social media interventions, and provider-based educational interventions in order to motivate kidney patients to receive transplants and living donors to donate. In 2009, she founded the non-for-profit suite of educational programs and training called Explore Transplant, followed by an Explore Living Donation, which enable transplant and living donation educations to reach more individuals. Sponsored by Astellas, we welcome Dr. Amy Waterman to this CDRP webinar.
I am so happy to be here. And I do the hard part of making sure you can see my slides. That's the only hard part of today, I think. Everybody good? Can you see?
Yes, all good.
Wonderful. So I just wanted to thank you so much for allowing me to present. I am a massive fan of the country of Canada. There got to be a point with my Explore Living Donation and Explore Transplant work that I was coming to different parts of Canada to either give grand rounds or to help with educational development. And at one point going through the people who let you in, they said, "Are you a resident of Canada?" Because I had so many stamps on my passport from Canada coming in and out, and they were concerned I was possibly doing something bad. So I would be proud. Thank you for questioning me, but no, I'm just a frequent visitor, and I've missed being there, but I appreciate this time together. So I heard from the grapevine when I asked who's going to be in the audience today that there are people that are leaders in research, that are clinical leaders. There's also patients and donors. So I want to just really have you get that this is a talk that I want to really be a contribution to all of our audiences. And for the patients and living donors who might be listening, you're particularly important because that's really, this work is what you are all about. So for people who haven't met me yet, the piece I want to say is I really am about connecting with people and helping them kind of have as much positive health change as they can. I don't assume always that I know what's right for a given patient, but I can say that if somebody does want to make a difference in a certain area, I have been trained in the tools to be able to do that. And one of my biggest highlights of my career was I was able to speak at the White House when President Obama was there to really say everyone deserves equal access to transplant in the United States. And that was a very powerful moment for me. I've shifted from other places. I've had the privilege of being in many transplant centers now, and I'm proud to be at Houston Methodist Hospital's Transplant Center. They've asked me to start a patient engagement, equity, and education center here. So I am honored to do that. And what I'd say very simply is I'm a patient advocate. What's best for patients? Every one of us is going to be vulnerable, scared, overwhelmed, and need information in the course of our life. And for me to be able to source that is an honor. So I have an amazing team of people who work with me. These are some of my leaders, and other people are here as well. But basically, we work in a space of patient-oriented research, focusing on improving patient knowledge, decision-making, educational delivery, tailoring of health messages through digital storytelling, and targeted health communication to improve health outcomes. And I just want to also invite you, Dr. Davis is going to be speaking in a few weeks on a second part of this work, so you can have a chance to meet amazing Dr. Davis. And the lab that I'm working in now has this as a focus: to understand and overcome the critical modifiable barriers affecting kidney transplant rates and outcomes. I love the word modifiable. I think we often talk about things like diversity and equity, and we say, well, there's a gap here. So I think there's a big push right now, and more than I've ever seen in my 25 years of working in this field, of being very patient-centered and really looking at what the disparities are fully, not just, oh, there's a slight disparity here, but like, where are the disparities starting? What do we need to be doing as a healthcare group? We can talk more about that if you want. So the thing that I wanted to say when you look at articles is they keep talking about chronic kidney disease as an epidemic. And it's interesting to me because I don't think that's quite as visible to the American public or the Canadian public, but this author said in 2017 that it's going to be reaching epidemic proportions over the coming years. So the thing that I want to say here is we are all attacking this, supporting change in an area that is getting quite serious. And if you really want to look at the numbers about that, 37 million Americans have chronic kidney disease, and over 700,000 have kidneys that don't work. 4 million with CKD in Canada, with almost 50,000 that have kidneys that don't work. And we all know, I know I'm preaching to the choir here, but in the United States, if you look at the survival rate over 5 years with getting staying on dialysis or getting a deceased or a living donor transplant, we know that getting a transplant's better. In the US, this is the pattern of people who are able to get access to transplant. So my career has been about how do we help more people benefit from the second and third bars. And I think that's, we're all on the same team here. What we're seeing here is there's a 35% increase in CKD since 2008 in Canada. 25% of people are crashing into dialysis, according to some of your articles. More than 3,000 are waiting for a kidney. And in 2020, 448 people were able to get a living donor kidney transplant. So again, great work for all the people who are doing this, having clinical conversations, creating change, helping living donors get excited to do this. And you're facing the same challenges we are in America, where we still have to keep playing the game forever because we're just not overcoming the disparities and really meeting the need. So also looking at the declining, we're seeing in the US, and it seems to be the same, that pair donation is increasing, but direct donation is decreasing. And that was particularly with COVID years, it got even worse. This was a paper that made me sad because it really represents a lot of work of myself and other colleagues. There was a paper in JASN in 2021 that said there's been a failure to advance access to kidney transplantation over 2 decades in the US. So I've been working on this for 2 decades, these 2 decades, and it's not making a difference. And I know there are many, many changes happening for the positive. And the other concern for me is that it says that the rates are actually worsening among the vulnerable population, despite everything that's being done. So where I come from is I'm hopeful, and I'm hopeful sometimes when I shouldn't be hopeful, but I never give up on our patients. You know, we just have to keep going, knowing that these kind of disparities are showing up. And this is a study that happened from Dr. Mushi. And you basically see here that the people who are able to get living donor transplants are Caucasian, and you're not seeing the gap as time passes to of other people getting it. All right, so we've got to have a paradigm shift, right? We keep having to grow, change, be more creative. What can we do? The big message when you read the literature, when we say, well, what are we missing, is this is a multifaceted approach, which I really, really believe. And most of the interventions now say if you are not trying to make a difference at multiple levels of care and with patients and with families, it's not going to be as successful. So if you look at this is kind of the socio-ecological model where you see the patients at the center, and the patient obviously has a group of people that support them. They have a potential donor, we hope, but then how we treat them, their organization is important. And there's a lot of work. I know the ENACT studies happening in Canada right now where we're really trying to do organizational change and consistent change to help increase the number of living donor transplants. But then you move out into these larger circles, the community. So obviously there's things going on in healthcare, there are things going on in the family, but what are we doing in our community? What are our media messages? What are organizations that are leaders for our patients doing right now? And are they part of the challenge? Are they, you know, what I've seen in the US is that there are many, many amazing interventions, and they're often happening at a single part of this circle. So the key is, can all of our actions be working together? And then finally, what kind of laws and standardization of care can we do? We had a big success that we caught up to you, where we made sure that immunosuppressant drug coverage is covered for more than 3 years after dealing with that for over a decade, when you all had that. So I want to say that by attacking all of these things in a combination, we have a lot more chance of things being effective. We also need to be even more innovative than we are now. I love that this word is now everywhere in terms of here's how we're trying to innovate educationally. Here's how we're trying to innovate for certain communities. Here's how we're going earlier. So I would love anybody who's working in innovation to share about that so I can learn what you're doing. So I wanted to take a second, because I'm a little bit of a data geek, and show you some data and think about what this means. So we did a study when I was at one transplant center, and we just followed people, white and African-American patients who presented for transplant evaluation. And we wanted to see over time who ultimately got a living donor transplant. And the answer was pretty clear. The people on day one that came in very ready to allow a living donor to volunteer for them. They were like, I'd love a living donor transplant. If somebody would give me one, I'm in. They may or may not have had one. They were 4 times more likely to ultimately get one in the next few years to come. But the other part too was that the people who walked in with more knowledge, those things are the modifiable factors, right? So do we have people who are willing, who are motivated, and who have more knowledge? Then those are people who are going to go forward. Again, we have that there's a trend where white patients were more likely to get a living donor transplant. We found almost in every transplant center in the country that this is a trend. But I want to show you something else. Now let's look at the donor side. Okay, so if that's what's happening, the people who walk in prepared, knowledgeable, motivated, ultimately can get a living donor transplant, have a higher association that they will. Now we go to living donor kidneys. So I think this is fascinating. We did a study where we went to 5 different transplant centers and we surveyed potential living donors, and we watched to see who became actual living donors. And we found a trend where white potential donors are more likely to become actual donors, and Asian potential donors are more likely. And you can see the trend where Black and Hispanic potential donors are less likely to complete evaluation. Now, these are people who at start came in. And a lot of times we say, what's going on with this, right? Oh, it's probably because the people that are Black or Hispanic, maybe they were less healthy. That's a common statement I hear when people talk clinically. So I want to show you, this is pretty interesting. So this is a model of that does show again that Black and Hispanic patients were less likely to actually become donors when they presented at the beginning. But here's the other factors. So the people who were more likely to be donors were more likely to be had a close relationship with the recipient. So they were either a direct family member or the spouse. Also, the people who walked in the door who thought that they were doing it for themselves, that they were really proud of themselves, interestingly enough, were less likely to be people who became donors. The people who were more likely were people who felt more of a space of spirituality or religion to donating. You also see the same trend where the people who walked in the door and say, are you ready to take actions to become a living donor? Are you ready and willing? They're more likely. And have you gathered information? Have you learned things? You're more likely. So there's the same trend again on the other side, actually. So whether you're a patient interested in getting a transplant or whether you're a potential donor who's interested in becoming a donor, the people who make it through are more motivated by a few things. We can talk about that if you want, and they're more knowledgeable at start. Okay. So I want you to go back for a sec and think about the multi-level intervention. So what that would mean is what we're doing outside of transplant centers is quite critical, because whatever is happening out there is affecting them coming in and being ready to go. Okay. So more to come on that. So if I look at what I'd like to happen, and I think all of us would like to happen at this point, there would be this thought that if we need to be getting the word out earlier, we would probably having a whole lot of general transplant information available to the public, to potential living donors. You just hear, you can give blood, you can donate money to a nonprofit. Oh yes, you can give your kidney if you want. And here's how you find out about it. And then as you move in, patients and family members who had kidney disease in their family would start to learn that, oh, your kidneys, let me explain how a kidney works. Let me explain that your kidneys are getting damaged. And then there's options. And before people's kidneys fail, they would be able to have all the facts and kind of line up their potential living donor. The family's learning too through community groups. About would I ever be a donor? What would a donor go through? We'd have education in dialysis centers where people get all the options, and we're now dealing with how do we refer people forward to transplant centers once their kidneys fail. And then we would have living donor education both at the start of evaluation, but that over time. In the US, I was at UCLA, they have a 7-year wait for an O kidney. So if somebody's waiting 7 years, we want to be doing something really supporting them each year. How's it going? Do you need support on finding a donor? How do we talk to your loved ones? It can't be just we get them listed and then we wait, right? And then finally, post-transplant education to make sure that the kidney that they received lasts forever or as long as it possibly can. This is ideal. This is how it would look in images. So imagine, you have all the information available online or in apps. You have families talking way early while the kidneys are still working. This is dialysis. When this starts, there's a provider saying, okay, let's have an effective conversation and see if we can move forward. And then finally, for people who move into the transplant center as potential donors and as a patient, that we are really there for them, helping this happen. So I want to ask you, this is really interesting. Okay, people have said to me, well, all the living donors have already been found. They've already shown up at the transplant center. And if you'll remember, we found that they were more likely to be white or Asian. They were more likely to be religious. They were more likely to not feel a need for being proud. They were more ready and they were more knowledgeable. Okay, so have we found all of them? I think that's a really interesting question. And if we haven't, where might we be going to find them? This is one we should talk about. So what I would say is, if I said to anyone in the public, would you ever be a living donor? The answer, people would answer in one of a few ways. Some people would say, I wouldn't consider being a living donor. I do good in other ways. I'm fine, but that's not for me. I respect that. To me, those are people that they've made an informed choice and I'm not trying to change them. Then there are people who say, Amy, I would do that. I would do it for anybody that I love, my family members, my friends, that I get it. I love them. I'd also get up in the middle of the night if their car had a flat and I would drive out in icy storms to help them. So it's all in the same space, really, of the person that I care about. And you see that in the predictive modeling, that family members are the ones that are more likely to come forward. But then there's another group I would consider donating to anyone because it fits into my spiritual or worldview. And this is interesting because this is showing up in our model too, that people who say my spirituality, helping people in need in general, not a particular person, but somebody in need, that is part of the motivation of getting people to step forward. And you can understand also that people could be in both of these blue boxes, right? That both of these things motivate them, especially if they have somebody that is in need of a kidney. So we think about that and we go, okay, great. So we now know there must be people in one of the two blue boxes, one or both of them. So we go, okay, let's go find them. Let's go to support groups. Like, I'm really friendly. I'll go out and I'll sit in every support group and I'll talk to people and all of that. So if you think about this, how did you first learn that you could donate a kidney? So has anyone ever told you? And some people here are actually face that. Other people have started the discussion of living kidney donation at some point. So if you think back to when you first started hearing about it, were you in a support group listening to real people who were talking about it? I don't know about you, but I was watching TV. So Grey's Anatomy's on, and there's kidneys and ice in little cartons, little igloo cartons, and people are running. And that is kind of how a lot of America currently thinks about organ donation. The other part is, in the United States, there's only 6,000 living kidney donors a year. So you just don't have as much chance to meet the people. You had about 500 living donors last year, 448. So the key here is you have a dramatized portrayal of something that's happening. And this is now how we're all forming our opinions. And people have done research on this. They've said, you know what, viewing a show like Grey's Anatomy helps actually form your attitudes about this, and can have African Americans, Caucasians, and Latinos form negative kind of opinions about this, because often these stories are tragic or shocking or all of those things that make a really good show, but don't make a very good healthcare experience. And so I want to tell you just a funny story. So here I am sitting at TED. TED actually started today in Vancouver. I have a few friends that have gone. And the reason I have friends on my Facebook that are talking about how excited they are is because there was one year where I got to go to TED. And the reason I got to go there is because a kidney patient stood for me going there to see if there were any kind of paradigm shifting changes that could be discovered from listening to the leaders of TED. And she paid for me to attend that year. And that year, interestingly enough, Shonda Rhimes was talking. And for people who don't know who this is, Shonda Rhimes is actually the creator of Grey's Anatomy. So I had the opportunity to go and talk to her and show her the article that I just showed you and say, hey, we're building stories about transplant. We want to solve the organ donor shortage. And she's like, you should come to Grey's Anatomy. Well, sadly, she moved on to Bridgerton, and I did not get to do that. But what I also want to say, if you think from a patient and an advocate sort of a way, is that patients can do a lot more than we have allowed them to do in the past to help steer our decisions, strategic and practical. We can have patients help define what value in medicine is. And the big message for me is, if scripted stories are what are causing people to form opinions, what if we could build real life stories? I don't know about anybody on this call, but I have been touched and moved in the course of my years in this field by amazing stories of great people. And I think that the fact that my life is more fulfilled because of those stories. And I've just gotten to live with these stories as part of my job. What if those stories could be disseminated? Okay, so when I went to TED, basically what people said was that living donation is a really great and amazing story. You're not using any of the tools to get people curious about it that we use in media and we use in all of these other ways. What if you add those tools to what you're doing instead of boring brochures that no one reads? I bet you could have more living donors appear. And that was my gift from my patient, that basically to say, use the tools of media and entertainment to see what you could do. So from there, I left TED and I said, you know what? I wonder if we could build storytelling libraries. As beautiful of the stories that I've heard, could we possibly help these stories be easily available for people? And I love this quote: how we behave matters, because within human society, everything is contagious. Sadness and anger, yes, but also patience and generosity, which means we all have more influence than we realize. So in this time of the Ukraine and the fear and the, all of the things, we also get that the beauty of living donation is something that can disseminate through our cultures as well. So I wondered if you guys would be willing to share, and you can either put it in the chat or you can just open up and share with me. But I was wondering if we have some patients in living donors. So if we built a living donor storytelling library, what would you want to hear in it? Why would you tune into someone else's story? Would anybody be willing to share about that with me? And you can feel free to share on the chat if you don't want to talk, but feel free to talk. What did you first want to know? If you were thinking, and if you haven't been in this,
Donna?
hi.
Donna, you got your hand up?
Go ahead.
Sorry, that's a mistake.
She doesn't want to share. Okay, so so somebody else. So what would you want to know? So Anne said, I would tune in as part of the workup process to learn what to expect as a donor. Great. So kind of the real life story, Anne, right? Like they could say, this is what you'll go through and this is what you'll go through. That's great. Okay, how about this one? Hold on. What information would be most helpful for you to know? So for me, I would want to know how bad it would really be. Oh, Heather said that my liver would grow back. Yeah, Kelly, oh my gosh, yes, she just want to know my liver would grow back. What are the risks? So Christian said, what are the risks of getting a transplant? I would be like, how would my life be better? I would like, would my life change? That kind of thing that I would be curious about. And why would you want to talk to somebody or listen to a story versus just read a brochure or talk to a doctor? How would what do you think that would be possible if you heard a story as opposed to just the doctor saying, well, I can tell you what it'll be like on the other side? How would my life change? How painful would it be? Yes, Heather, you had a peer mentor. That's great. As a donor, Anne would want to know that what the long-term monitoring would be for me, how I'd access my screening, what would my doctor need to know? Yeah, these are so great. Thank you all for sharing. I really appreciate it. Would I need to take medication?
Yeah, I didn't picture.
Other people? Go yeah, go ahead, Linda. Linda,
Yes.
go ahead.
I'm actually a living donor.
Mhm,
My husband's a transplant recipient as well. He had a heart.
mhm.
But the thing that I often say to people is, don't be afraid to ask somebody to be a living donor.
The fear about asking, absolutely. So
Well,
yes. Mhm.
Yeah, because you go through so much testing. They want to make sure that your organ is good for the recipient as well as that you're going to be good and be able to continue on.
Yes.
That's
So
something I say to a lot of people. Actually, I said it this morning when I met up with somebody.
so great. So you're a peer mentor already. Yes. Yeah.
Go ahead, Donna, after Linda.
Go ahead.
Donna.
I guess what I would want to know is I would want to talk to someone who'd walked the path before me. What it is like at that center? What is it like to be a living donor? What questions should I be asking? How to prepare?
Yes. Yes. Right.
Those
Like,
types of,
yeah.
and even as a recipient, I would want to know that as well. I find that is the most helpful thing in all the Facebook groups I belong to, is you get to talk to people who have walked the path before you. It may not be your path, but it might be very similar. And forewarned and education takes away a lot of the anxiety.
Yes, I agree. For me, it's having the right expectations, right? Like, how bad is the pain going to be? How long am I going to be doing this? Like, whatever the anxiety I would have, if it's like, okay, you just have to this is how long, and you can do it. It also helps me to see people on the other side that are okay and on the other side. I don't know about you guys. Really great work. So wonderful. I'm with you 100%. Okay, so I want to talk about storytelling for a second as a tool, Okay, and I know we all get what storytelling is. Storytelling is relatable, relevant, emotional, and engaging, right? And digital storytelling uses technology in a very efficient way to collect meaningful stories. What I love about it is that it gives the ability to skip me. Okay, so if you met me at our transplant center here, I'd be hopefully I'd be a contribution to you, but also there is a wisdom of people talking to people like them. And often you only meet those people in rare circumstances. So the idea is, how do we have a diverse group of people sharing their wisdom and having that available so that you don't have to go through me and I don't have to in some way mess it up. And the difference between digital storytelling and traditional education is this, and I'll start on the right. Traditional education is provider prescribed content, right? Here's a brochure. I'm giving it to you to read. Usually it's pretty formal and factual. Sometimes it's health literate, sometimes it isn't, but that the providers are the authorities. The doctors are saying how it is, whether they're using videos or print material. If you go to digital storytelling, it's created from the patients or the living donors. It's informal. It presents experiences and sometimes facts, but really the full experience. It's health literate because it's a story organically. It can also be given to you in whatever language the person speaks. You don't have to only read it in English. And when you hear the storyteller, it's usually someone who looks like you, who's faced similar challenges. So I also want to say something else to people who are thinking about using storytelling in education. I don't think they're the same thing. I don't think you can fully replace traditional education with digital storytelling. I think it's more powerful when you put a plus between the two of these so that you have stories and you add them to traditional information that a patient would need to know. So why does it work? I know you know this organically, but let me say it. First, it gets people curious. Stories are easy, accessible. It also empowers storytellers to talk about the issues that truly matter to them, not what I think they should share about. Peer-to-peer sharing. Stories allow for emotions, humor, fear, tears, growth, all the stuff that we all connect with in our hearts. It's also gentle for some of our learners to bring them factual information about the risks of living donor transplant is something way far away from where they are. But if you say, well, would you like to hear a story of somebody who was a living donor? People are like, I could do that. And finally, it can culturally ground the message. The storytellers can look like the viewers. The storytellers also can be wearing the clothes and speaking the language. Now, we know stories organically can be quite powerful, but what I did not know, I'm a scientist fundamentally, and I said, I wonder if they can actually change health, right? How do we connect them with health? How can we improve health? So we first did a scoping review to see when people are using stories in trials, and we found that there were 22 trials. Now, there could be a lot more, but when interventions included storytelling, you could see changes in improved attitudes and knowledge, but also in health behaviors like quitting smoking and lowering the A1C levels. So there's really a lot of work to be done as a community, but there's a sense that yes, stories added to other kinds of health interventions can make a positive difference. The other part that I know we all care a lot about is how can we reduce ethnic and racial disparities in access to transplant? And what I want to say is that we have many communities that stories from wise elder shared to younger person. This is a normal way that information is shared. Historical and cultural values and norms are shared in this way. The other part is that I've talked to different groups and they've said, yeah, this is a way that people feel safe using. So it's just interesting to see. All right, so with all this being said, we started off to see if we built a digital storytelling library, would anyone come? So we joke like you have a good idea, Ted, and it fails on the tarmac, right? So I want to just walk you through this. And I want to say how excited I am to be partnered with the Canadian Blood Services, because we built a living donor storytelling project with people who look like all the people in these pictures are real people. They're not ads. They're people who decided they would tell their story to help other people. And we opened the library, which you can find, it's open now at explorelivingdonation.org in 2019. And in 2020, early 2020, before COVID, we opened it for Canadian stories. And so the first part was our formative work of just trying to understand how do you collect stories and what can we learn. So I want to walk you through what a storytelling library is. So I want you to compare it to something you could probably do pretty normally. So right now, if I said, get out your phone and start talking to it on a video, you could do that, right? You don't need me, you don't need a library, the whole thing. It's good, it's easy, but there are a couple challenges that happen. What would you like me to share about? You might ask me. What if you got a phone call in the middle of filming your video? Sometimes the technology gets interrupted, or you talk for a really long time because you kind of don't know what's most valuable, right? So with the digital storytelling library, you start with a set of open-ended prompts. So the idea is, could you please share about this dimension in whatever way you want? And people are talking about their fears about transplant or living donation, questions they have about it, motivations, the risks and benefits, the challenges. And then in the course of our early formative work, they completed a post survey about the reporting process. So let me give you a couple of examples. So if you were a donor, an open-ended prompt might be something like, looking back, the best part about donating a kidney was blank. I don't know what you're going to say, but if you could say that, it would be a contribution to somebody. We built these prompts with a patient advisory board and a donor advisory board where they said, oh, this is what I wished I knew. Very much what you guys just said in the previous slide when you were sharing. Somebody else said people would talk about their life on dialysis. They would talk about how their life changed. They would talk about, it was amazing. So if you look at these kind of when I learned what kidney failure would mean for the recipient, I felt this. And then you'd hear donors talking about how they made their decision. So we created a set of starts of open-ended prompts, and we allowed people to film these stories privately. We saw people filming them in their home. Now that this is Zoom, when I first started this, people didn't understand. I'm like, you know what? They film it on their computer or their phone. Some people were filming in their car because it was privately, and it looks like this. So if you said, hey, I want to tell my story, you'd fill out the information, and then they would show you the potential open-ended prompts, and you would choose the ones you wanted to do. And then you would get a screen like this on your phone or on your computer. And the prompt is up there. It says, hi, I'm Amy. I donated a kidney to my brother about 3 months ago. And then there'll be more complex questions. I ultimately decided to donate a kidney because da, da, da. And so I would start to share, and this just let people share. The piece that we like about it is that if somebody feels, oh, I didn't say that exactly like what I wanted to say, you can just redo that question until you're satisfied. So what happens is people share and they move forward and they share it for the next one. And they move forward and they share it the next one. And at the end, they say, this is what I want to say. And they say, I release it. So the best moment after my surgery was this. And then people share. Looking back, the best part about donating a kidney was. So that's what it looks like. And here are some examples of people who are sitting in their houses. As you can see, Luther up there donated to his daughter, and she was in the video as well. So, and they're up there sharing their stories to be a contribution to people. And it's kind of beautiful and amazing. So I want to show you on the left are the living donor stories. These people all donated a kidney. And on the right were the recipient stories. So these are people who gratefully received their kidneys, both talking about, the process of going through this. What I also want to say, and we're seeing a lot of this in our field right now, is that there's also the opportunity for people to film stories who need a kidney. So they shared about, hi, I'm in this situation, and if you'd be willing to consider being my donor, it would mean a lot to me. And whoever is sharing, they always get their footage back. And this footage can be posted to Facebook and Instagram and all the places that they have a community. They could go to their church newsletter. So this allows people who want to use a tool to build a really nice video and to send it off at no cost to them. So this has been wonderful in terms of getting the word out for those people. The other part that's been really popular is that what we realized was if you get our library has about 200 stories now, right? So if I said to you, well, which story do you want to watch? You might say, I want to watch a story that's like a woman who looks like me. Or I want to watch all the Canadian stories, or I want to watch a story in French. So I think we have a couple stories in French. We need more. Or it might be a topic. You might say, I want to talk to somebody. I don't care what they look like or where they live, but I want to talk to people who are afraid of allowing their son to donate to them. Or I want to talk to somebody who is waiting for a kidney transplant now. Okay, so what we've tried to do with these stories is code them and make sure that they are available for people to sort. So you can go online and explore. And we don't have a lot in certain areas, but every time we have somebody, we sort them. So this was our formative work. We've done more since, but we had 153 total storytellers, and they spent about 11 minutes telling their story and 62 minutes filming it. So remember, they would go back and they would edit. So what's interesting is you've got to give yourself the time that it takes. So you feel really proud of the final product. But what I also want to say is we need to do more to support our diverse community, because I want this library filled with people who look like all of us. And what we're seeing is the first volunteers out of the gate tend to be living donors, and there tend to be white females. So, and people who are college educated. So if you are somebody who says, hey, I know a great diverse story that we can add, well, I'm also happy to have people who look like this be added, but it's really a sense that let's have people who walk every walk of life in this story and who've had all sorts of different type of living donor transplants, including ones that have failed. Let's not make this an ad. Let's have it just be real life mentoring. We talk about it being mentoring, one directional mentoring, because obviously if you meet a real mentor, you can go both directions. So here's some sample videos, and let me see if I may have to stop my share and share again because of that person so that I can make sure you can hear it. Give me 1 second. Nope, we're okay, good. I want you to hear the video.
My name is Katie Walker.
Hello, my name is Richard Hicks.
My name is Matt Ronan.
My name is Susie. Emily.
My name is Diane.
And I donated a kidney to my cousin. And I donated my kidney to my brother Carl.
I donated a kidney to a stranger.
I had the honor of donating my kidney to my daughter Monica. She was 3 years old at the time.
I was motivated to donate a kidney to my brother because of, one, what he was going through, and two, that my brother needed a hero.
It was really powerful. It was a powerful moment to see somebody go from so sick to looking so much better in such a short period of time.
It was, words just can't describe it. She just and her color was back, and she looked so good.
The best moment after my surgery was on a Saturday. My brother came downstairs. I was eating breakfast and kind of doing my thing, and he said, bro, guess what? And I said, what? And he said, I don't have to go to dialysis.
I would just encourage you to remember that a very short interruption in your life, a matter of days or weeks, can make the difference in the rest of someone else's life.
So what you can see there is that those are bits and pieces of the gold, is what I say, of different stories that we can put together. We can use these in educational sessions, marketing sessions. The story at the top is Cindy. She's a kidney donor, and this is her whole video. So I don't have time, so I'm going to keep going, but you could just go to the library and see. So what I want to say is a few more kind of interesting behind the scenes things. So the next piece is we were looking at what kind of things are people sharing about. So the point, we were all sharing what we think that they were sharing about. We saw a lot about what themes they were sharing, what emotions, what advice they were sharing. We really have a new paper on that as well. So it's been really exciting to just look at, when offered a platform, what do people want to share about? So it's often easier just to let you listen.
I donated a kidney 2.5 years ago to my husband.
I received a living kidney donation from my wife.
And I donated a kidney to a very good friend of mine's brother.
I had many questions about how this would affect my wife, Carolyn. Well, how would this impact her physical activity or mental health?
I'd never had surgery, so what would surgery be like?
How can we both do this? If we've got kids, who's going to take care of our kids?
Ask to speak to someone who has been a living donor.
Your team that works with you in terms of doctors, coordinators, social workers are so phenomenal. You can literally tell them anything.
I was surprised at the support I got. I was surprised at the simplicity.
My favorite memory of this entire process and journey is afterwards, my wife's friends and the doctors and nurses and the donor staff treating my wife like the hero she is.
Another thing I think that's really amazing is you can actually code the emotions that people are sharing about. And I want to show you this. I think this is such a wonderful example. So when the kidney patients share, when they start talking about when they needed a transplant, understandably, they talk about fear and anxiety. And when they find a matching donor, they start to feel happiness and relief. They're sharing about that in the stories. And then they get a little bit anxious before surgery, understandably. And then they feel happiness and relief again on the other side. They actually feel more happiness and relief when they find the donor as opposed to when the surgery they're through, which is just so great in terms of what they share about. Not that they feel this way, but if you hear the stories, this is kind of the patterns that you're hearing. And on the other side, this is fun too. The living donors feel very sad when they hear that somebody that they care for needed a transplant. And when they said that they were matched and they know they matched, they get happy and relieved again, but they get really happy after the surgery. So after they've gone through the pain and are recovering, they're so happy that it's working and the person can return to life. So we have actually living donors are happiest after the surgery, according to their shares, which I think happier than the recipients. So they're the happiest of all after surgery. So here, I'll give you another feel of this.
The best moment after my surgery was when the doctor came in and told me that my friend who was in the room next to me had just peed.
Another good moment after surgery was the first time I urinated, because that was another little fear I had. Like, what if I never urinate again normally?
His exact words were, "Your kidney was peeing all over my hand before I could get it attached to the ureter."
The absolute best moment after my surgery was finding out that my recipient was, in the words of my husband, peeing like a racehorse.
Life was just about eating and peeing. By the end of dialysis, I barely could pee anymore. And so just to be able to do that was like a gift.
There's so many great things in this. Oh, okay, here's another one.
Living again without a kidney means you can't eat pizza. That's probably worse than dialysis for me.
My family actually brought me pizza in the hospital, and I swear I got tears in my eyes because I didn't know that was how good pizza tasted.
Seeing him for the first time and he's devouring pizza when I had zero appetite whatsoever, it just was maybe the very best moment of my life.
When the moon hits your eye like
Great. So you can kind of see and feel the greatness of this, right? This is not for me. I just get to be the space to capture this. But I want to just thank these 200 people who have told their stories. And the thought was, okay, beautiful people, thought-provoking, funny, heartfelt. Wonder if we could use this to increase living donation, right? So we started a media campaign. And we wanted to just test it. So between October and March of last year, we sent out digital ads, video ads, and paid searches for people that were using the internet. And to give you a feel, these are people who told their story in a wonderful story in the library. We found the gold of the story, but we didn't know what was most motivating. So there are people here who are sad and really need a kidney. There are people here that are donors and recipients. There are people that are bringing hope and humor. So we didn't know what kind of content would be something people would connect with. We also didn't know what messages would work best. So meeting others like you. So if you see this, so imagine if you're on Facebook or you're on Instagram or you're searching for, you're on a public site and a little ad like this comes up, right? Explore stories of hope. Would you ever do that? Help your patients find a living donor. Would you do that? So we had no idea what we were doing. This has been an exploratory campaign, but I want to show this because I think there might be some people who like this kind of work and it's pretty fascinating. So we sent out little bitty videos, 200,000 of them, 650,000 video ads, the fixed ads. And then for people who are typing in, I want to be a living donor, we would send them videos and ads. And we were really looking at potential donors, people seeking a kidney, and actual kidney recipients and donors. And for sake of time, I'm going to show you a couple things. So the first part is engagement. Okay, so it doesn't matter what you get an ad for, the place that a lot of times the digital ad people will say is, wow, they clicked on your ad, right? You sent them a advertisement to a restaurant and they clicked onto it. So which audience engaged more with the campaign? Which messages caused them to click on it? Which ones did they watch? Which campaign strategies were the most effective? So engagement's really important. But remember, what I care about is health behavior change. So I wanted to know, did they go to learn anymore? You can watch a video, right? But if you go to the site and you're learning about living donation and thinking about donating your kidney and watching these stories and telling your story, now that we got movement by sending out these ads. So I want to give you a feel of success. So you'll be glad to know, or you'll just think this is funny. All those ads that we get bombarded with on our sites when we're on our phones, the bottom line is they have a low success rate. So this is a series of success numbers. So less than 1% for all of these, right? 0.05%, 0.1%, 2.55 if you actually type in for something. So the chance of people engaging is really low, and people are thrilled when this is the rate. So how did we do? When we sent out an ad of something beautiful that somebody said, or something about the Living Donor Storytelling Program to our audiences, did they engage? So let's start about the potential donors. So what we found was when somebody was searching, could I be a potential donor? And they got these ads from us, 8% of them actually went through, clicked in to see the video, but then 2,800 of them went to the web page to learn more, reading information, watching videos, and some of them even told their story. So if you're already engaged in this, if you're already curious, this campaign's extremely well received for those potential donors. Now, the people who got the little ads in the, whether it's print or video, they're more likely to respond when they have video than print, which could make sense to me too, but very few of them actually move forward. So really, we were able, in the magic of the internet, would be to find people who are interested in being a donor using search words and deliver this information to them. And wow, 8% of them got engaged. How about those seeking a kidney? I need a kidney transplant. My kidneys are failing. Kind of the same story. If we can find the people who already know that they're seeking a kidney, they really appreciate this and they go to the program and they begin watching information and thinking about it. We can actually see what messages work and what videos are most effective for them. And again, videos are better than print information. What's shocking though is look what happens. So during this campaign, we wanted to see what happened with our website. We found that we had an 8,200% increase in entrances to the pages as based on sending this out to everybody. And people spent longer on the pages. They were less likely to bounce out and exit. So it's an incredibly powerful way to get people curious about living donation. The takeaway metrics for this campaign were these. We had about 5,000 people who viewed the homepage, 1,310 people who read Living Donor Education, 1,013 who watched stories, 154 who viewed the Share Your Story page that they wanted to share their own story themselves, 79 registered to share their stories, and in that 6-month period, 28 actually did. So what I would say, going back to that question that I think we all care a lot about, are there more potential living donors? Can we reach out to the public and find the people that are interested and help them learn outside of transplant centers? This shows real promise that we can. Now to look at how storytelling might be helpful to people who are in different roles in the community of organ donation, that I would say a few things. If you're in an education role, I really feel that stories are a wonderful entry into learning. So for people who are brand new, people who are scared about kidney failure, going to explorelivingdonation.org is a great place to have them feel safe and learn a little bit, but not get overwhelmed. It also allows people who are sharing similar concerns and people who are of the same race to get to meet other people like them. I think that some of the medical mistrust that is just a valid part of our care, unfortunately. This is a way to show that different people get kidneys and they all look different. Different people donate kidneys and they all look different. Now, if you're in a transplant center, which is where I am, or if you're in the community with a support group or a mentoring program, I love mentoring programs. We've had challenges with geographic barriers and COVID. So the thought that I have on this is, could a mentor tell their story in the library and then could say, hi, here's a mentor we have. Would you like to meet them in person? I see that these stories could be almost an ad for an amazing mentor to give them more attention at a later date. You can also have these kind of stories be directly answering certain questions. So there was someone in our group that said, I want to know what the evaluation process is going to be like and how painful it's going to be. So you could put a bunch of people sharing about the pain in a small video and have that available to say, here are 5 people talking about the pain. The other part is where we're using them in different centers that I've been. We're going to have these stories. They could be in public places like on TVs or iPads. They're just used wherever we want to add warmth and a different way of learning and delivering information. Finally, we're now building stories into MyChart and Epic at our hospital, where you can basically embed a link of a story kind of from the library itself. And somebody can get, here is how you park. Welcome, you're about to start transplant evaluation, living donor evaluation. Here's where you park. Here's a story about living donation. Here's all of the different things. You can embed practical things and stories so that they're learning before even presenting to a transplant center. So I want to say a couple things, and I'm totally open to questions after this. So people asked me immediately after this, could I tell my story? I know some people who might like to tell their story. So what we've been asked to do, now that you hear about this, is if you could help us add stories, knowing that I'd give you the video footage back for whatever use you had. We're actually doing a second part to this program on May 2nd, where we're actually going to show people how you build your story and the tips and tricks about how you can do this well. And we would love to have you be in this library. And I'm sure the Canadian Blood Services would be also very grateful, because they are building a campaign in Canada around these stories. Great, thank you so much.